As the U.S. reports its highest number of COVID-19 deaths in a single day today, the CDC releasing a new guideline this week, changing the amount of days required to quarantine from 14 to 10 after COVID-19 exposure. Well, tonight, healthcare workers in the area are weighing in on this. 5 News reporter Bailey Devane joining us live with more on that. Bailey?
That's right. The guideline since the start of this pandemic has been 14 days of quarantine if you are exposed to coronavirus. But that guideline is now changing for the first time. The CDC is now recommending only 10 days of quarantine after exposure to coronavirus with no symptoms and only 7 days of quarantine with a negative test result.
By shortening that, there's the potential for letting out a handful more cases.
One family physician says she has had some patients show symptoms after the 10-day period. She says with this new guideline, some coronavirus cases could slip between the cracks.
You know, they've said all along that you can be contagious for 14 days, and I have had patients truly not have symptoms until day 12, and they tell me that.
Some healthcare professionals say this change could be happening to increase testing efforts.
Patients' unwillingness to be tested with the risk of being quarantined for 14 days and missing work for 14 days.
But according to CDC officials, they say they came to the 7 to 10 day decision after studying the incubation period for the virus. And the CDC officials say there is some hope this will encourage more people to quarantine.
If you have such issues in your community where you don't have nurses and you don't have doctors because they're all out on quarantine, or you don't have teachers because they're all out on quarantine, so therefore you can't have schools open, they're having to make these concessions in order to keep things staffed, more than concentrating on what is necessary to stop the virus.
In Springdale, covering news where you live, Bailey Devane, 5 News.
Wearing a mask, social distancing, and other safety guidelines still remain the same, and 14 days of quarantine is still recommended in areas where testing is not easily accessible.